Hi, welcome. We'll give a few minutes for people to come in. Welcome, everyone. And just give it another minute or so. Great, welcome. All right. Hi, and welcome, everyone. Thanks for joining today's webinar hosted by the Psychosocial Rehabilitation Advanced Practice of British Columbia. My name is Tracy Windsor, and I will be your moderator today. Before we begin, I'd like to acknowledge that I am hosting this webinar from the unceded ancestral and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. Recognize that Indigenous peoples have been the stewards of these lands since time immemorial, and I'm grateful for the opportunity to gather, learn, and work on these lands today. I also encourage each of you to take a moment to reflect on the lands you are joining from and the Indigenous communities who have long cared for them. And so you're welcome to also put in the chat where you're joining from today. Before we get started, here's some housekeeping items to ensure you have the best experience today. So this webinar is being recorded, and a link to the recording will be emailed to you afterwards. We can't see or hear any of the attendees, so don't worry about muting yourself or having your camera off. You can just see the panelists and myself and colleague Regina. Please use the Q&A panel at the bottom, question and answer, if you have any questions at any time. At the end of the session, we'll have a Q&A period, question and answer. You can also upvote any questions that you would also like to have answered in case we have kind of a lot of Q&As, we can answer the top voted questions. And if you experience any technical difficulties, send me a message in the chat and I'll give you a hand. Today's session will focus on psychological health and safety of healthcare workers. We'll begin with a presentation from our speakers, again, followed by a question and answer period. And we're honored to have Karina, Urdaneta, and Michaela Keogh from the Mental Health Commission of Canada with us today, who bring valuable expertise on psychological safety in the workplace. So with that, let's get started. I'll hand it over to Karina and Michaela to begin their presentation.
Thank you, Tracy. Hello, everyone. Good morning. I think we're morning on your side. We're afternoon over here. But thank you so much for joining us. My name's Michaela Keogh. My pronouns are she, her, and I am a senior program manager on the Prevention and Promotion Initiatives team at the Mental Health Commission of Canada. I've been with the Commission about 8 months now, or nearing 8 months, and prior to this, I was working in post-secondary mental health. I will pass it on over to my colleague Karina, who can introduce herself, and then we'll dive in.
Thank you very much, Michaela, and thanks everyone for joining. My name is Karina Urdaneta, and yeah, I've been with the Commission for about 7 years, working in several projects on structural stigma, recovery-oriented practice, and of course, this project that has been great for us. So yeah, I'm very happy to be here. Thank you very much.
We are also joined today by our manager, Kamlesh Tello. She is just in the chat though, so if you do see her popping around answering any questions that might come up, please know she is with us and holds so much valuable information. We wanted to start by acknowledging that the head office of the Mental Health Commission of Canada is located on the unceded traditional territory of the Algonquin and Anishinaabe Nation in what is now called Ottawa. As a national organization, we also acknowledge that we work on the traditional lands of many different nations. Today, a path to truth and reconciliation begins with recognizing both the stewardship and the sacrifices of the original peoples. We are committed to recognizing the errors of the past, acknowledging the challenges of the present, and contributing to a new and respectful relationship with First Nations. So today, Karina and I we're excited to be here with you virtually to talk a little bit about psychological health and safety in healthcare working and learning environments. So we have a bit of a discussion a little later on a case study. We're really hoping that you'll walk away with some practical resources and some supports for yourself and your teams. So with that, we can go to the next slide, Karina. With that, we wanted to acknowledge that sometimes the subject matter being discussed throughout this presentation may deal with sensitive, uncomfortable, and potentially triggering themes. We want to make sure that you all take care of your well-being. And if you find that you need some support, you can reach out to any of the resources on the slide, to your local distress center, or to somebody that you know that can support you. It's important to remember that even though we are mental health professionals, we work in mental health, it's also always okay for us to ask and for us to seek out that mental health support. We do have a very packed agenda, so we're hoping that this will be a very knowledgeable session, that you'll walk away with some really strong ideas and some good knowledge of some resources available to you. We do have some case scenario or one case scenario we'll be discussing later, but we do encourage you to put any questions that you might have in the chat. You can definitely use the Q&A feature, but we're going to try to keep answering the questions on a rolling basis that might come up in the chat. And so with that, I will pass it on over to Karina.
Perfect. Thank you so much, Michaela. And thanks everyone again for joining us. So we believe that most of you are familiarized with the psychosocial rehabilitation domain. So we wanted to connect our presentation with the domains, of course, and we were glad to see that several initiatives at the MHCC can support these 5 domains. So even though the focus of this presentation is on psychological health and safety, which greatly aligns with domain B, professional skills, we would like to take a minute to mention a few other MHCC initiatives that can support the other domains. So, for example, this is a great resource on the right, developed in partnership by the MHCC, CAMH, and a couple other organizations. This is a great training package for healthcare workers to provide culturally adapt cognitive behavior therapy for people of South Asian origin living in Canada. And also at the MHCC, we have a page on recovery-oriented practice with great resources like the guidelines and a great video titled Food for Thought. We also have a page on mental health and substance use related structural stigma that also offers great resources like a great free online training. And our colleagues in Opening Minds, which is the other side of the MHCC, they also develop and deliver great trainings that can support these domains. And of course, as I mentioned, we have a page on psychological health and safety in healthcare that includes great resources that can support these domains. So, okay, let's move to psychological health and safety in the workplace. So Psychological health and safety in the workplace is a systemic support provided within an organization and within teams to actively prevent and minimize the risk of psychological harm from work-related causes and promote mental health. So it's very important that it is embedded in the way people interact with one another and the way working conditions and management practices are structured within the organization and within teams. And also that psychological health and safety help address the root cause of psychological stressors. So, excuse me. So yeah, let's see some of the benefits. So so psychologically healthy and safe healthcare workplaces can lead to a variety of benefits, not only for healthcare workers, but also for healthcare organizations and, of course, the clients accessing care. So we can usually see enhanced workforce well-being, less absenteeism and turnover, also boosted productivity, less errors, improved morale, relationship, and sense of purpose, which also enhance organizations' reputation, and this helps with recruitment and retention. And of course, in the end, this reduce healthcare costs and improve patient satisfaction and quality of care. So a healthy environment leads to improved team learning, team performance, and continuous quality improvement environments. So most of these findings are from the National Standard of Canada for Psychological Health and Safety in the Workplace, also known as the standard. So let's take a quick look. Okay, so recognized as a leading practice by the Health Standards Organization, the standard identifies at least 13 psychosocial factors that can affect psychological health and safety in the workplace. So, and I say at least because the standard identifies a 14th factor, which are factors specific to each industry. For example, after further research, the MHCC and Healthcare Can identified 2 psychosocial factors especially relevant to healthcare, which are protection from moral distress and support for psychological self-care. So in total, this would be 15 psychosocial factors. So for easier understanding and implementation in healthcare settings, the MHCC and the Canadian Healthcare Workforce Network cluster the 13 psychosocial factors, plus these 2 additional to healthcare into 7 themes. These are the 7 themes. Let's take a look. So there are organizational and team culture, workload management and work-life balance, or integration, work-life integration, clear leadership and expectations, psychological protection, protection of physical safety, protection from moral distress, and support for psychological self-care. And as I just mentioned, these last 2 are the ones especially relevant in healthcare. So now I will pass it over to Michaela to explain each of these themes.
Yeah. We should have noted at the beginning, we are happy to share these slides. So if you're scrambling to take notes, please feel free to scramble a little less. You will receive a copy of these. But starting off with organizational and team culture. An organization's culture is made up of the norms, values, beliefs, meanings, and expectations that employees share and base their behaviors on. Positive traits of an organization's culture can be trust, honesty, and fairness, all of which can promote psychological health and safety in workplaces and learning environments. So what defines a psychologically healthy and safe organizational culture? Civility and respect. So this is where our staff are respectful and considerate of each other, patients, caregivers, and other healthcare disciplines. Engagement, this is where staff feel engaged, not only with their work, but with their colleagues, with the meaning of their work. Involvement and influence, where workers are included in discussions and have a role in relevant decisions related to their jobs. Psychological and social supports, where both coworkers and supervisors are supportive of employees' psychological health and safety. This support can include paid vacation time, health leave, and wellness time. And as well, recognition and reward, where workers' efforts are acknowledged and appreciated in a fair and in a timely manner. So the second theme is workload management and work-life balance. Having too much work and not enough time to do it is one of the most significant stressors in workplaces in Canada, and I don't think that's a surprise to anyone. To effectively balance workload demands with personal and family lives, healthcare staff must have enough time to complete the tasks and responsibilities that they are assigned. A healthy workload management and work-life balance can include resource management and access. So it's not just about the amount of work that makes a difference, but also the resources that a healthcare worker has to access in order to perform well. So these resources can include physical space, equipment, funding, that's a huge one, technology, as well as human resource support. So how many people are working towards the same goal? How many people are working on this project? Growth and development, where workers are encouraged and supported in the development of their interpersonal, emotional, and job skills. Psychological demands, where a work environment is a good fit between the employee's interpersonal and emotional competencies, and that the requirements of the role, such as working hours, support their overall psychological health and safety. And then finally, work-life balance, where employees must be able to effectively manage the demands of personal, family, and work life. Workers should be encouraged to take their entitled breaks, such as lunchtime, health time off, and parental leave, without feeling like they simply can't, or if they do, they're going to be coming back to more of a mess than when they left. So in psychologically healthy and safe environments, leaders should provide clear and effective communication. They should ensure that employees understand their roles and how they contribute to the organization. Leaders provide helpful feedback on their expected and actual performance, and they also ensure that employees are informed about changes in a timely manner. It's important to remember that each leadership style can and does impact the psychological health and safety of team members. For example, instrumental leaders tend to focus more on outcomes. They pay a little less attention to the overall organizational and team culture or how team members are as individuals. Transformational leaders, on the other hand, tend to focus on long-term goals, and they care more about their team leaders' growth and their overall development. These transformational leaders are the agents of change who transmit a sense of purpose and motivation for employees. There's a quote that we absolutely love from the article Leadership Essentials by the Canadian Medical Protective Association, which says, "The golden rule states, treat others as you would want to be treated. But when it comes to psychological health and safety, the platinum rule prevails, which is treat others as they would want to be treated." So psychological protection can be seen when staff feel comfortable enough to ask questions, seek feedback, report mistakes and problems, as well as propose new ideas. It is critical that leaders actively work to protect employees from stressors that could harm their mental health, including harassment, bullying, discrimination, violence, and stigma. In the context of mental health and substance use health, stigma can be defined as devaluing, stereotyping, labeling, and discriminating against people living with mental health and/or substance use health problems or illnesses based on negative assumptions and beliefs. Mental health, substance use health-related stigma can interfere with other factors important to workplace well-being, such as psychological and social supports, organizational and team culture, and psychological self-care. We don't quite have time today to go into the 4 different types of mental health, substance use, health-related stigma, but we've already shared in the chat a really great resource on structural stigma that we encourage all of you to go back, take a look at, maybe not right now, but after the webinar. It's a really great resource that goes over these 4 types of mental health, substance use, health-related stigma and structural stigma as a whole. So moving on to protection of physical safety. A physically unsafe environment can create concerns and anxiety amongst team members. Staff must be protected from hazards and risks in a physical work environment. Risk could stem from policies, training, a lack of demonstrated concern for employees' physical safety, and other factors. Leaders and organizations can protect staff members' psychological and physical safety by providing sufficient training for everyone to work safely, ensuring safety concerns are taken seriously. So if something is reported, that they're actually actioning and protecting their staff in a timely manner, ensuring work schedules allow for lunch breaks and rest periods, and embedding protection of physical safety in all policies and procedures. So now we're getting into the first of the 2 psychosocial factors that are especially relevant in healthcare settings, the first one being protection from moral distress. So moral distress is an umbrella term for stress responses that healthcare workers may experience in relation to an event, decision, or patient case that challenges deeply held personal or professional values. Staff should be able to perform their roles with a sense of integrity and the support of their profession, employer, and their peers. Organizations and teams can protect staff from moral distress by showing support during adverse situations, ensuring that staff have human resources and equipment necessary to provide quality care, providing access to appropriate trainings, and developing policies and guidelines to address morally distressing events. And the very last theme is support for psychological self-care. In a psychologically healthy and safe work and learning environment, staff should be encouraged to care for their own psychological health and safety, including encouraging them to take lunch breaks, and vacations. It should be promoted and embedded into the organizational and team culture, where leaders should be walking the talk or walking the walk when it comes to psychological self-care and upholding these policies and practices that are designed to support staff. These practices and policies should also include having regular debriefs and check-ins, and supervisors who facilitate psychological self-care should be able to recognize the worker's need for personal autonomy, managing workloads appropriately, and prioritizing and demonstrating a positive work-life balance. When thinking about psychological self-care, try and think of it beyond just an individual level. Organizations have a huge role to play in our ability to care for ourselves, including making visible commitments to embed self-care into organizational structure. So that was quite a lot of content to throw at you right at the beginning. So to kind of lighten things up and to get you a little bit involved here, we're going to go on to a brief activity. And so we're going to ask you all to, you can either scan the QR code on the screen, or you can go to our Slido link. And we're going to ask you in 1 or 2 words, describe what a psychologically healthy and safe workplace or environment means to you. What does it look like? There's no right or wrong answers. One person typing. I'll let one response come in before I start giving hints. Respect. That's a big one, both where you feel respected You are providing that respect. You feel you are giving or you're receiving that respect as well. Respect for your patients. Where people excel, it's a big one. You want to feel like you're excelling personally, professionally, supportive. It's also really nice when you've got access to appropriate equipment, the human resources capacities. Friendly, listen to. Over put that one is a big one where you feel that whether it's with your supervisor, maybe your team, you feel when you bring something up that you were listened to. Non-stigmatizing, appropriate workload. Excellent. Okay. Well, you can all continue to think about that. You can also put the words or what, as we're going through, a psychologically healthy and safe workplace means to you. I know for me, the big one is being listened to, that you're on a supportive team. And I overall think like engaging with the work that you're doing and feeling good about the work, that it aligns with who you are, really helps to build that safe environment. So we will kind of pause that activity, but again, continue to add those words into the chat if you would like. And I'll pass it on over to Karina, who's going to talk us through our psychological health and safety toolkit.
Thank you very much, Michaela. So yeah, that was a great explanation. Thank you so much for that. So in order to support organizations in their efforts to embed psychological health and safety in their healthcare environments, the Canadian Health Workforce Network and us, the MHCC, developed the Psychological Health and Safety Toolkit for primary care teams and training programs. It was launched in March 2025, and you can scan the QR code or click on the link in the chat. Perfect. And this toolkit is a set of over 125 evidence-informed resources focused on team-based activities, policies, and practices to promote psychological health and safety in healthcare workplaces and learning environments. And all the resources focus on the 7 themes that Michaela just explained. So let's take a closer look. This is how it looks like. As we mentioned, it's broken down into the 7 themes, and we can click on each of them to have a great explanation on what it means and to look at the resources. They can be easily searched through 10 filters shown on the left: theme, format, intervention level, audience, sector, setting, identities, cost, country, and language. So we can click on each filter to display the drop-down menu with a few options to select from. Then, so we click on Show Results at the bottom, and the resources will show like these blue tiles on the right-hand side. And we can click on Read More and then view the resources, like these ones on the right, so about psychological safety developed by the Canadian Medical Protective Association, or supporting our staff. This is a great resource from the UK that I really like. Also, your health space and caring for healthcare workers. So let's see, that went quick. So I will pass it over to Michaela for a case study.
So we are going to do a bit of an interactive but anonymous case study here. We find that sometimes when we're talking about psychological health and safety, and when we're talking about these resources and how psychological health and safety there's a role for everybody in it, it can sometimes be really helpful for us to see a case study and to kind of walk through a little bit about what the different levels of intervention can look like. So I'm going to go through the case study. I'm going to say it. I'll read it aloud, and then we are going to, on the next slide, we'll encourage you. There's 3 different ways that you can participate. But the case study is due to staffing shortages, overtime has been steadily increasing over the past 2 years. Although the extra pay has been enticing to a few people, there has been a noticeable increase in staff turnover due to burnout. Staff have also expressed high levels of stress due to insufficient access to equipment and unclear changes in administrative processes. There's a lack of support and poor communication from unit leads on how to address the issues, and staff are struggling. So we'll take that, sit with it for a second. But we are going to encourage everybody to participate in a bit of an anonymous discussion, one of 3 ways. So there is a QR code on the screen that you can scan. You can text in your answers on your phone, but definitely, I know my preferred method is going to menti.com, and we'll put the link and the code in the chat. Karina's already on it, and using that code to participate that way. If you go that route, you can also continue to see other answers rolling in. Or maybe you're not as tech savvy, maybe you're on a small screen, you can also just text or put your answers to the questions in the chat. So we'll give folks another 5 seconds to kind of choose a way to participate. And don't worry, the case study does come back, so we're not asking you to memorize it. Okay, we'll move on to the very first question. So what actions can staff take to support their own well-being and support their team members? So you should be able to see the question on Menti. And if you would prefer not to use Menti, you can also participate in the chat. But what actions? So, due to staffing shortages, what can staff do? What can they do to support their own well-being and support their team members? We have one response that is quit. You're not wrong. That, I think, is always something that we should be taking into consideration. If that job is no longer serving you, if you feel you have tried your best, or if you just feel that's it for me, you've got to protect your own space. Delegate tasks when needed. That is incredibly important. It can also be really hard to do sometimes, to even recognize that you need to delegate and then start the process of delegating. It can feel like a second job sometimes. Reduce admin work, a very big one. Streamline it as well. Bring concerns to the boss. Yep. Ideally, you have a good relationship. You're able to bring this up, and that they're able to, as the supervisor, address these concerns. Take time off when needed. A big one. It sometimes feels really hard to take time off or to prioritize your mental health, but it's a big way to come back and actually be able to feel fulfilled in the work that you're doing. Express concerns with each other and to management about the struggles they're experiencing and the impact, especially long-term. Great. Sleep and eat well. Yeah. So try and do things that are within your control. Bring in temp staff. If you have the ability to bring in some additional support, if your team is drowning essentially and you're seeing all of this turnover, staff management to book lunch and learns for staff, to have wellness programs available like yoga, meditation, bring nourishing snacks, drinks, take a look at the staff spaces, make them comfy. I think that go out in nature, spend some time in nature. I think what I'm really appreciating, ensure that onboarding is done correctly, new staff are trained and included. I'm really appreciating that these responses are very much based on what a staff member can do. And sometimes you don't have the ability to make these big system-wide changes, but what can we do as a team member, as an individual, to protect ourselves, to make sure that if we're in this situation, we're still prioritizing our health and safety? Because at the end of the day, prioritizing our health and safety is also how we support our community, the people that we're serving. Book time off and stick with it. I think that also means not checking your emails when you're on holidays. You've said you're taking the afternoon off. You're done at noon. Get out of here. Don't look back. And I think part of that also is having, again, leadership walking the talk or walking the walk. How many times do we know of somebody in a leadership position, they're taking some time off and you're suddenly getting a few emails in your inbox from them? It's can be very difficult, but it's really important that we stick to our dedicated time off. Great responses, folks. So we'll go on to the next question, which is what actions at an organization level would help address these issues in the short term, the medium term, and the long term? So think big picture, let's say you're the big CEO, you're the big boss, you're the head honcho, or you're really just thinking as a staff member, this is what I would like to see my organization do to support me if you're experiencing these same staffing shortages. From this case scenario, the organization has been offering additional pay. It's not really working because we're still seeing this turnover. So what else would you like to see, or what else could the organization do? Back up employees to cover vacations, sick days. That goes back to the conversation where to take time off and to feel well charged, you actually have to feel like you're coming back and things have just been business as usual. You're not coming back to 700 things in your inbox, or the department has kind of been backlogged because you've been away. Start all meeting at 5 past the hour to ensure staff has a stretch break between meetings. This is probably one of my favorite, what we'll call like easy to implement recommendations. When you're in back-to-back meetings all day, if you've been running around, you haven't had a chance to eat, grab water, stretch your legs, anything like that, even just saying, folks, we're going to start 5 minutes after, or we're going to end the meeting 5 minutes before, doesn't feel like a lot initially, but it can make a really big impact on your overall self, on how you're feeling through the day, knowing like, okay, I am going to get a moment to go up, stretch my legs, grab a glass of water. Recruitment efforts to student programs for practicum students. We've got a whole group of post-secondary students constantly looking for experience, and sometimes they're overlooked a lot of the time because they are younger. They maybe don't have the 5 years of experience needed, but they're almost always incredibly eager to learn. Hire more staff, point blank period. Yep. Ensure staff debriefing adequately, appropriately, in a timely manner. Implement regular rhythms, routines that involve giving breaks to staff to celebrate staff wins. Bring fun activities to give breaks to staff. I think that's a huge, huge one. Sometimes, especially in the healthcare setting, it can feel like there's a lot of stuff going on. Maybe it's not all positive. And so to stop and say, hey, look at what we've done. Look at what this staff member has done. And to really genuinely appreciate the work that has been going on can make a huge difference. Give staff opportunity for feedback, survey, and then follow up with suggestions from staff. I will say that is huge. How many times have we completed an employee feedback survey and then there's been no follow-up? You complete it and then that's that. So I think this suggestion is brilliant with also having that follow-up. Tell staff, this is what we've heard, this is what we're doing with it. Service redesign. As something's not working, how can we get it to work? Update policies to reduce risk. Engage research and evaluation teams to make work more efficient and effective. Brilliant. Not relying on your staff internally to kind of figure everything out. If you can hire consultants or external support, why not? Great. Okay, we'll move on to the third question, which is what actions at a team level would help address the issues in the short term, medium term, and long term? So think in this situation, you're a manager, maybe it's your team that's had fairly significant turnover, let's say it's a team of 10, you've been experiencing a lot of turnover, you're seeing your team are struggling, what can you do as a manager or at this kind of team level in this team leadership position? What could you do? I also see in the chat, Karina has given away one of our secrets where we try and have some shorter meetings, so 25 minutes or 45 minutes, so that we do have some in between time. And also not being afraid if a meeting's going to end early. A meeting ends early. I don't think anybody ever objects to having a handful of minutes back in their day. So back to the team level, communicate more, better, and often. I think communication is a really, really big thing. Team discussion to better understand staff pain points, challenges to address, letting the folks who are feeling a lot of this turnover and a lot of this anxiety tell you this is what we're experiencing. This is the biggest challenge as a result of this turnover. Support each other. I think as a leader, not being afraid as well to hearing any criticism. Sometimes we have our defensive up, and I'm sure if you're in this position where it's your staff who are turning over and are really stressed, you're also probably feeling really stressed, but making sure that you're doing the best that you can to protect your team, to support your team, and then talking with your own supervisor about what you're experiencing. Ask frontline for ideas. Brilliant. Hire Doge, kidding. That's good. Really timely for what is happening right now. Speak up when something doesn't support psychological health and safety. That's a big one. I think as if you're a team lead, a manager, you do have an obligation to be supporting and protecting your team members. And it can sometimes feel quite scary if you're in an environment that maybe doesn't support the speak up culture. But to be able to say, this is not great, this is not conducive to a healthy environment, being able to say that and communicating to your team, I think openly that here's what we're trying to do to better the situation, which all goes back to that communication. Right. We will move on to our last question for the case study. I should press the button. The last question is, what resources would support you or your team if you're experiencing these issues? And this is when I'm going to put in another plug for our psychological health and safety toolkit. We'll re-put it, Karina's already on it, as re-put it in the chat. I encourage you all to go right now, take a look, pull up the toolkit, take a little look through using the filters that Karina outlined and see if you can find a resource, or maybe you know of another resource right now that would help you or your team if you're experiencing these staffing shortages, this burnout, this lack of communication from your leaders. I'll highlight one of the big ones. Excuse me, and I hope I'm not going to beat anyone to the punch about this, but supporting our staff, a toolkit to promote cultures of civility and respect, as well as the caring for healthcare workers toolkit are two really, really great examples of tools that you can find in our psychological health and safety toolkit. And they're really helpful within the psychological health and safety toolkit as well. You can filter through a variety of different, 10 different filters to try and get some information or support for whatever fits your need. I also like to highlight there is that cost option. A lot of times the healthcare sector does not always have an endless amount of money to spend on psychological health and safety resources. And so there is that cost option where you can filter through for free resources as well. So I'll give everyone maybe one more minute to kind of leaf through the toolkit and see if you can find any resources that might support if you are experiencing this. This is a resource that the toolkit that we do encourage you to go back to use. Bring it back to your teams, back to your organizations. It is a really easy tool to navigate and to use if really you need anything. And I think one of the best features about it is the fact that there are so many different format levels. There's so many different intervention levels. And it's a really, really great way. If you don't know where to go or what to do, it's a really great starting point. So with that, I just wanted to say thank you all for participating in the case studies or in the case study. I know it's a Friday, and so sometimes it's a little bit to participate, but thank you all. These responses were wonderful. And I think you all took kind of what Karina and I were talking about and have really applied it in a practical way. And so before we move on to the Q&A, just wanted to provide a little closing where we've seen that the quality of healthcare services is impacted by the psychological health and safety and well-being of healthcare workers. Everybody throughout organizations, throughout the healthcare sector, has a role in creating psychologically healthy and safe workplaces, teams, and learning environments, especially healthcare leaders. Karina and I and the entire Mental Health Commission of Canada invite you to continue to explore the Psychological Health and Safety Toolkit at teamhealthandsafety.ca. And we are always happy to take any questions, whether it's today, maybe it's next week, anything that you might have related to psychological health and safety in healthcare working and learning environments. We are always more than happy to have emails rolling into our inbox. So with that, we would like to take this time now to invite any questions, comments, real life scenarios, anything like that that you might have. You're welcome to put it into the Q&A portion or Q&A feature, or you're also welcome to put it in the chat. But Karina and I, as well as Kamlesh in the chat, are more than happy to take any questions that there might be. And also, thank you for listening. Thank you for joining us on a Friday. Morning for all of you, afternoon for us.
Folks, maybe just as people are getting together with their questions, I just want to take a moment and say thank you very much for a wonderful presentation, for your work and your commitment to this good initiative to keep us Canadians healthy and well in our position. So big shout out to you both. Thanks for taking the time, and we'll just see if there are any questions in the box. So Tracy and myself here. Maybe we just don't have questions today, and maybe that's just how it is.
You know, I sometimes don't always have my questions put together immediately after something. So
I could ponder things too. I know.
Yeah.
You mean. Yeah.
And it is a genuine offer. If there are, you know, questions, maybe you're sitting on the questions, maybe it's a scenario-based question that you're not quite comfortable asking in a larger group setting, feel free to send either of us, both of us, an email. We're always happy to support how we can.
And you have certainly given us a lot to think about and 50 million thousand resources to keep us busy. Thank you very much for that. It's great. Appreciate being able to apply your good work. Thank you. Tracy, maybe over to you.
Sure. Yeah. Thank you both so much. Wonderful presentation. And we will send out a recording of the presentation along with an evaluation form sometime next week. So keep an eye on your inboxes for that. And yeah, thank you again. We've got some comments in the chat. Awesome. Well, thanks everyone. Have a wonderful rest of your day. Thanks, Michael, Sue.